You're watching Colorectal Cancer, a Matter of Fact on ABC 27, brought to you by Penn State Milton S. Hershey Medical Center.
When cancer struck a Schuylkill County woman 10 years ago, all of her friends pulled together to help her through it. Here's her story.
A chilly day outside the Schuylkill County Courthouse. But when 61-year-old Charlotte Smigo walks inside...
How are you? So good to see you.
She gets a very warm reception.
You look great. Thank you. Great. 10 years coming up.
These women are family to Charlotte. She worked with them for years at the courthouse.
Worked across the hall from each other and would see her every day.
She would come to our office every day and have lunch with us.
It was over lunch when Charlotte broke the news to them. She had cancer. It was discovered during a colonoscopy.
Unfortunately, Dr. Narula couldn't do the whole colonoscopy because he couldn't get up there because the tumor was right at the base of my bowel.
She was devastated by that and scared, like almost anybody would be.
Oncologist Dr. Harold Harvey treated Charlotte and knew the best way to take care of the cancer.
We gave her treatment with chemotherapy and radiation therapy before the surgery.
The goal of this approach of preoperative chemotherapy and radiation is, first of all, to downstage the tumor. Some of the tumor may disappear. That will make the surgery certainly easier.
I told her anything that she needed, I would do for her. I would help her in any which way. And I gave her my full support.
And Charlotte needed support. She had to travel from Pottsville to Hershey every day for radiation and chemotherapy. That's about 50 miles one way.
Charlotte is single. She lost her husband. We know she was pretty much by herself, and you don't want anybody to go through that by themselves.
We had gone to the judge, and it was basically, she has to go. You're all welcome to help and take her, just take turns.
It was decided that the girls were going to take me down. They had talked to Judge Baldwin, and he said, just do it.
We used our vacation or our personal time, and we would take off.
One day I would go, say Monday, and then Susan would go Tuesday, and the next person Wednesday, and we would just alternate every day.
We owe Judge William Baldwin, our president judge, a great deal of gratitude for that, because he was very generous and understanding about her condition.
The daily trips to the med center lasted for 5 weeks.
She managed to get a lot of help from her and support, not just driving, but a lot of emotional support, because it's a traumatic thing to be diagnosed with any cancer. But she bore it well, and I think her friends had a lot to do with that.
Charlotte says they are more than just friends. She calls them her angels.
You know, God sends us angels in many ways. They were my angels, believe me, because they did so much for me.
It's a nice title, but I don't feel that I'm an angel. It's just what I always do for anybody and everyone. They need help, I help.
Many times to me she described them as her angels because they were so understanding, so helpful, and so sympathetic to something that was really a very serious problem.
Doctors say radiation and chemotherapy took care of her serious problem.
It shrunk the tumor down to almost nothing. And so the surgeon was able to join the bowel to the remnant of the rectum, and so she's now able to go to the bathroom normally. She does not need a colostomy or to wear a bag.
Charlotte says her friends and her faith paved the way for her during this difficult time.
I'm just grateful to God. I mean, God has blessed me so much. People would say, oh, you were lucky. I said, no, I wasn't. I was blessed.
And Dr. Harvey says since it's been 10 years since the surgery, she is most likely cured of cancer. Let's check back in with us in the studio with Chuck.
Thank you, Deborah. And joining us now in the studio is Dr. Wafiq Al-Diri, the Chief of Division of Hematology and Oncology. Doctor, it's been 10 years since Charlotte was treated. How has chemotherapy changed over those years?
Well, chemotherapy are medicines that we use to kill tumor cells, and chemotherapy has side effects including things people are familiar with, such as hair loss, nausea, vomiting. The chemo can lower the blood counts and suppress the immune system. And the body has to recover from chemotherapy. That's why it's given every few weeks to let the body recover. Now, the newer chemotherapies are more targeted to the genetic mutations in the patient's tumor, as well as chemo that chokes off the blood supply. And these tend to have less toxicity than what we've been used to in the past.
I want to ask now, Charlotte had radiation therapy. Why is that combined with chemotherapy?
Well, chemotherapy is often combined with radiation therapy, sometimes to prevent relapse and to get a better outcome. And this is done, for example, in rectal cancer, pancreatic cancer, sometimes in lung cancer or brain tumors. And the radiation can often be used to get those troublesome, painful lesions. And radiation, of course, has its own side effects and is generally planned by a radiation oncologist. And when a patient is getting both chemo and radiation, this is generally coordinated between the medical oncologist and the radiation oncologist.
Now, when a person finds out that they need chemotherapy, what questions should they ask their oncologist?
There are some important questions to ask having to do with what side effects to expect, what the quality of life will be like, and how the chemo is working. And it's important to keep having those discussions as time goes by. Is it still helping? Am I able to do the things that I need to be doing? And it's always important to also ask about, are there newer treatments that are coming along? So at our Cancer Institute, there are clinical trials that are testing new approaches to treat this type of tumor, and things are changing pretty quickly, and we're excited about that.
So make sure you ask a lot of questions.
Yes.
All right. Well, thank you, Doctor, for coming in, and we'll be right back.